Hi, I'm Dr. Veda. It is very nice to meet you. So, I see you are here for your annual physical exam today. Okay, excellent. Physical. And I was looking through your paperwork. I just noticed that you seem to have left the date of last exam blank. Do you have just an estimate? It doesn't have to be exact at all. Oh, okay. Yeah. So this is your first ever doctor's appointment. Okay. Oh, that's really exciting. Then, first of all, thank you so much for choosing our practice and for trusting me. I'm really excited to be working with you today, and I'll make sure that I explain things pretty thoroughly to you where this is your very first time at the doctor, okay? All right. Yeah. If you have any questions as we're going along or need clarification on anything, just let me know, all right? We're basically just going to be doing a head-to-toe exam, looking at your vitals, making sure you are totally healthy, okay? All right. So, this is your very first time to the doctor. Do you have a particular reason for coming in? Have you been feeling sick at all? Or are you just hoping to get a clean bill of health and a checkup? Okay, that's good. That's great. So then we'll just go through the full exam, make sure you are healthy. I'd also like to schedule a blood draw for you where you haven't had that either. Yeah, okay. So at the end, I can schedule that for you and we can do blood tests for all of your minerals and vitamins, make sure everything is good. All right. So the first thing I'm going to do, I'd like to get your blood pressures. I'm just going to grab my stethoscope here so that I can listen. And also have a blood pressure cuff. So this just goes around your upper arm and we can get your blood pressure. All right. You just go ahead and uncross your legs for me. Thank you. I'm just going to put this around your top of your left arm here. Okay. And when I squeeze this, it's going to get pretty tight around your upper arm, okay? It can be a little bit uncomfortable, but it shouldn't hurt at all. All right, so I'm just going to tighten this up. And this inflates the blood pressure cuff. So you feel that getting tighter around your arm? Yeah, okay. There we go. All right. And now I will release the valve while listening. Okay. Go. There we go. Very good. Okay. Just set that aside. And I will set the stethoscope aside as well because I don't need it anymore at the current moment. And your blood pressure is 120/80. So that is perfectly normal and healthy. Very good. Now I'm going to take your pulse. So I'm just going to touch your wrist, okay? And for about 30 seconds, I will set my watch here. And I'm going to count the number of beats of your pulse for about 30 seconds so then we can get the beats per minute by multiplying it by 2, okay? All right, so I'm just gonna touch your wrist here and we will start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, per minute as your resting heart rate. That is a very healthy resting heart rate, especially where you're in a new environment, might be a little anxious, so your heart rate might be higher than normal resting. Okay, very good. And now I have this pulse oximeter. This just goes on your finger, just clamps on like that, painless, and it reads your blood oxygen level. Okay, so we're looking at a level of 98 and above right now. So I'll put this on your finger, and we'll just wait a moment for that to get a reading. Now, you a little nervous coming in today? Is everything pretty good? You seem very calm. That's great. Okay. Let's take this off. All right. You are 99%, so that is excellent. So those vitals look great. Now I'm just going to do a visual examination of your skin, okay? So I'm going to start with your face. And generally I could tell right away if there was some sort of issue, so face looks good. I don't see any signs of yellowing, which would be indications of jaundice. Okay. Skin is pretty smooth, no real signs of redness or irritation. Looking down into the neck, same thing. Arms and hands. Do you mind if I just lift up your shirt for a second? Okay, I'm just gonna look at your tummy. Okay, looks good. And everything looks good for your skin. So again, I'm looking for discoloration, dry patches, anything that looks out of place, really. Okay, that looks good. Just making some notes here. Nothing of concern, which is excellent. Now, in terms of your skin, have you been having any like itchiness, dryness, redness, anything out of the ordinary for you, or really anything uncomfortable? Okay, fabulous. So skin seems good. Now, I do notice a couple of moles. I saw, of course, the one on your face and then the one on your neck. So I'm going to get a measurement of those just to make sure that we don't see any growth over time that would indicate something was wrong. When I just examine them visually, they look just fine, not abnormal. We have regular borders, circular moles. It's not incredibly raised or flat, and the color looks correct. So we don't want to see like black moles. Okay, so I'm just going to measure this one on your forehead. Okay, we have about 3 millimeters. So 3 millimeters for the forehead, and now the one on the neck. And that one is about 2 millimeters. Yeah. So the neck was about 2 millimeters. Forehead was about 3 millimeters. How long have you had these moles for? Yeah, that's what I figured. So as long as you can remember, not new growths. Very good. All right. Now I'm going to move up to your scalp. Look through your hair just a little bit. We are looking for any signs of scalp issues here. So dryness, redness, hair loss, anything like that. We'll put some gloves on. And I'll just do a quick look through your hair and scalp. Any complaints you'd like me to take note of? Any itchiness, discomfort, flaking? Okay, so just a little bit, maybe dandruff? Yeah. Very normal. And we'll take a look at that and maybe note any remedies that you might choose to use for it, okay? So I'm going to come up here. start by looking through your hair. Alright. Your hair looks really good. Scalp looks nice and clear. I do see a little bit of the possible dandruff you were talking about. Yeah. Alright. Just get over here, under here. Good. Coming around this side. Just get out of the way here. Okay. Fabulous. Alright. So, I do see that little bit of dandruff that you're talking about. I do not see any other issues, which is great. So for that dandruff, very, very minor, I would suggest maybe even something like Head and Shoulders. There are also shampoos called T-Gel and T-Sal that Neutrogena makes. So that's a little bit more, has a little bit more of the active ingredient in it. But I think for your case, I would just try something like Head and Shoulders. Okay, so never tried that before. Yeah, why don't you try that first, because your case is very mild. And then if we see that that's not going away, you're still having the issues, we can look into different remedies. There are prescription options, but we'll try that first. Okay. Now I'm just going to feel your face a little bit. So I'm just going to palpate around your face. I am feeling for, again, any abnormalities. If anything feels tender at all. Okay, so no, everything feels okay. Alright, I'm going to feel down your neck as well. So I'm feeling here for any swollen lymph nodes. Does this feel tender at all? Good. And how about when I press under here? Okay. And how about when I press down here? Good. Okay. So, lymph nodes look good. Palpated the face. Everything looks good there. Okay. I'm gonna feel your temples for a second. Just clench your teeth for me, okay? Very good. All right. Thank you. All right. Now I'm going to bring my hands forward, and I want you to tell me when you can see them in your field of vision, okay? Bring them to the side of your head. Let me know when you can see my fingers. Good. We're going to try that one more time. Let me know when you can see them. Good. Okay. And I'm just going to take a look in your eyes. I have my pen light here. It's a little bit bright, so I'm going to shine it right in your eye, okay? Thank you. And the other side. Fabulous. Back to the first side. Okay. So right now, I'm just looking for a dilation response in your eyes. So your pupil should constrict and get smaller when that light comes in, and it should be a consensual response in both eyes. So if I do it to your left eye, then your right eye also constricts. And same thing if I do it to your right eye. Very good. Now, this is a different light. It's gonna flicker a little bit, okay? So just take a look at this. Good. Good. And the other side. Good. Okay. I'm gonna move it back and forth between your eyes. Good. Yeah, now let me know when it's at its brightest point, okay? There we go. Good. Yeah, the angle really matters on this one. Good. Okay. Fabulous. Now I'm just going to pull up on your eyelid very gently and take a closer look in your eye. Thank you. Okay, and the other side here. Good. All right. So, response to light looks really good. Now I'm going to have you follow a light. So, pull this up here. Follow it with your eyes, okay? Don't move your head, just follow with your eyes. And what I'm looking for right now is smooth tracking of the eyes. Good. Very good. So, smooth tracking is when your eyes go smoothly across. So you see how mine are moving smoothly. Versus sort of a stutter tracking, which would be like, see how my eyes just moved in steps? That's not what we want. And your eyes are doing correctly with a smooth tracking, so that's great. Alright. Okay, now I'm going to listen to your lungs. So again, I have my stethoscope. And if I press this side of the stethoscope to your chest, I can hear your heart or lungs amplified, so I'll be able to hear them. So first I'm going to listen to your heart, okay? Good. You can just breathe normally for this part, okay? Alright. Now I'm going to listen to your lungs. Again, just breathe normally. Just listening to your breathing. Good. Okay. Now take a nice deep breath in, okay? Deep breath. And exhale. Good. Another side. Inhale. And exhale. Good. Now I'm going to come around and put this on your back. I'm still listening to your lungs. Nice deep breath in. And exhale. And other side. Nice deep breath in. And an exhale. Excellent. Okay. So your heart sounds good. And your lungs sound good. For the lungs, I'm really looking to hear a clear sound. No rattling or sort of fluidy noises in the lungs. Seems really good, so good. Now, you haven't had any issues with your breathing lately, shortness of breath, finding you get fatigued more easily. Okay, excellent. And no history of issues with breathing, right? Okay. It sounds like you have been very lucky to be very healthy, so that's great. And nothing with your heart, no sudden racing of your heart. Okay, very good. No chest pain or anything. Good. Okay. So now I'm going to be taking a look at your ears. So we'll just look at the outside first. Okay, so I'm going to come in and take a look at your right ear first. So I'm just looking at externally your ear. I'm going to pull it just very slightly, okay? Good. Okay, and if I palpate your ear just a little bit, is that tender at all? Okay, good. Yeah, that looks good. And we'll do the left side as well, just looking at your ear. Okay, just gently touching. And pull gently on it. Okay, now just palpating very gently. And that's not painful at all, right? Okay, good. Alright. Now I'm going to take a peek inside your ears. I have my little light. So this tip, it's a fresh tip, goes right on here. It just goes in your ear so I can look at it with the light, okay? So I'm just going to look in here. So I'm just looking at your ear canal just to make sure I don't see any redness, or swelling, or wax buildup. Everything looks really good. And I'm also looking at your tympanic membrane, eardrum. Okay, that looks good. Now the other side here, same thing. Okay, so we're just looking at the ear canal, making sure everything looks healthy. No inflammation or anything. Eardrum looks good. I'm just gonna pull back on your ear a tiny bit to get a better look at your eardrum. Okay. Okay, good. Alright, that looks good. Not seeing any problems with your ears. And how about for you? Any issues with your hearing? Wax issues, which might be buildup, any itchiness or anything? Okay, good. So ears are good. And how about your hearing? Have you noticed any trouble with your hearing recently, like maybe having to turn the TV up or ask people to repeat themselves more frequently when they're talking? Okay, good. So ears seem okay. I am gonna whisper a few numbers into them and I'll just have you repeat those back to me, okay? Yeah, I'm just testing your hearing very quickly. 36, 14, 12. Very good. Other side. 52, 25, 64. Good, okay. And how about these words? Breakfast, gymnasium, math. Good. And this ear? Easter, holiday, work. Very good. Okay. So you did not seem to have a problem hearing any of that. Okay, good. Yep. Now I'm going to take a look inside your nose. So, same thing here. I'm not going to actually put this in your nose. I'm just going to look in, okay? Just going to come up under here. Alright, good. Very good. Alright. Yeah, I know that can be a little awkward to have somebody just looking inside your nose, but I promise I've seen a lot of noses and yours is very clean. Okay. Now I'm going to be using this little stick and we're going to be doing a sensation test on your face. So I'm going to touch you with either this end, which is sort of sharp, doesn't hurt, or this end, which is dull. So I want you to feel it and tell me whether you feel it sharp or dull. Okay? If you'd like, sometimes a little bit better if you close your eyes, that way you can't see. Okay, go ahead and close your eyes. Thank you. Okay. Tap. Sharp, yes. Tap. Sharp. Yep. Dull. Dull. Sharp. Dull. Down here. Sharp. Up here. Sharp. Over here. Dull. Right there. Dull. Very good. Okay. So you seem to do a very good job with that. You can open your eyes. Okay, thank you. So your sensation in your face seems good. We'll do a little bit of that on your arms as well, okay? Sharp. Dull. Sharp. Tap. Sharp. Dull. Okay, other side. Dull. Sharp. Sharp. Good. Sharp again. Dull. Very good. Okay. Great job. Alright, so now I'm going to look in your mouth. And I know you haven't been to a doctor before, but have you ever been to a dentist? No. Oh my goodness. Okay. So, How are your teeth, do you think? Do you have any pain, any issues, maybe chewing? Pain would be one of the biggest things. No. Oh, that's miraculous. That's fabulous. Okay. How frequently do you brush? Twice daily. And how about flossing? Do you floss? Every night. I love to hear that. Okay. Now, although you're not having any issues, I do strongly recommend that you go to a dentist just because they can go ahead and do a thorough cleaning of your teeth, which we do not do here. And they'll do a full exam to make sure that your teeth and your mouth and your gums, everything is healthy, okay? So I just do a quick look in the mouth for any overall health signs, but your dentist is going to be the one who does more thorough checkup of your teeth. Okay. So, I have this magnifying light, and if you could just go ahead and open your mouth for me. I'm just gonna look around in your mouth first. Your teeth really do look great. Oh my goodness. Okay. Yeah, for somebody that's never been to the dentist or had a teeth cleaning, your teeth look amazing. Very clean, your smile's very nice. Okay. Not seeing anything that causes me concern. Can you just open very wide and go, ah? Okay, good. And again, ah. Just looking at your throat now. Making sure we don't see any signs of irritation, infection. Okay, that looks great. So, teeth seem fine, mouth seems fine, throat looks great. You're not having any issues with your throat, haven't had frequent sore throats or cough or anything. Okay, that's great. Okay, can you go ahead and stick your tongue out for me? And move it side to side. Good. Move it to the left and then hold. Okay, I'm just looking at the right side of your tongue. And move to the right and hold. Good. Looking at the left side of your tongue. You look just fine. Fabulous. Okay, do a swallow for me. I'm going to look at your trachea. Go ahead and swallow again. Good. Okay. And swallowing for you generally is not painful or difficult. Okay, fabulous. Turn your head to the left. Good. And to the right. Good. So no stiffness or pain in your neck. Good. Okay. Do a big shrug. Excellent. Set this down for 1 second. I'm going to put my hands on your shoulders. Go ahead and do a big shrug for me. Good. Okay, so as you can see, I was kind of pressing down on your shoulders, seeing how you did with shrugging against resistance, really testing your muscle tone. In somebody your age, it's very rare to see this as an issue, so that's good. Can you do a big smile for me? Very good. Looking at those facial muscles. And can you do a frown? Same thing. And can you puff your cheeks out? Good. Okay, you can let that go. Alright. So everything in your exam looks good. Not seeing any problems at all. You haven't expressed that you've been having any issues, so I'm not really concerned about anything. Everything looks good. You seem to be healthy. As I said at the beginning, I do want to schedule you for a blood draw, just so that we can check all of your levels and make sure that everything under the surface is healthy. We can do that here, or I can send you to either Quest or LabCorp. Yeah, we like to stay in-house if we can, if it's convenient. So just look at the schedule here. What day and time looks best for you? We actually have some availability next week with our phlebotomist. Okay, we suggest mornings because I would like you to fast. Okay, yeah, we can do 8:30 a.m. on Tuesday. Okay, Yeah, that works. So we will do 8:30 a.m. next Tuesday. You really shouldn't have to wait at all. It should be really fast. When you come in, it's just going to be the same entrance, but instead of seeing me, you're going to see our phlebotomist, who is an expert in blood draw. Have you ever had your blood drawn before? Okay. So basically, they will use a little needle, just go into the vein and collect a few vials of blood for us to do our testing on. Very minimal pain. Some people get a little bit nervous from the needle, but our phlebotomist is fabulous. So they will be very quick. They'll be able to answer any questions or calm any nerves that you have on the day of your blood draw. Just don't eat anything after midnight on Monday night, okay? Yeah, we need you to have fasted to test your cholesterol levels, so just make sure don't eat anything after midnight. Then once your blood test is done, you can go get breakfast or something. Treat yourself, okay? I also suggest that you go to see a dentist. Even though your teeth look very good, they'll do x-rays and do a more thorough examination of your mouth. Okay. Have you ever been to an eye doctor? Okay. So you were saying vision seems good. You don't seem to be having any issues. I do suggest you still go and see an eye doctor just for the health of your eyes. They'll also be able to determine if you would be helped by any corrective lenses like glasses or contacts. Okay. But in terms of your annual exam here, everything we've done today looks very good. After your blood test, it takes us about a week to get results. Those are updated to your patient portal, and I'll also be calling you to go over them, okay? All right. So I have you on the schedule for Tuesday at 8:30 for the blood draw. They can give you a reminder card when you go out to the desk for your copay. And other than that, it was really, really nice to meet you. Do you have any questions for me? Okay, so the next time you need to see me, as long as you don't have any issues with the blood work and you don't feel sick at all, I would say 1 year for your annual exam. Would you like to make that appointment today? Yeah, that'd be great. Okay. So, let's see. Today is October 24th. We could do exactly October 24th next year. Okay. Does afternoon or morning work better for you? Yeah, I have a 2 p.m. I have a 3 p.m. I have a 4 p.m. There's a lot of availability because it's so far out. 2? Okay, so we'll do 2 p.m. the 24th of October, 2023. Already getting to 2023. Okay, so that's assuming that nothing comes up between now and then. That will be our next appointment. We will send you a text reminder, an email reminder. We can also give you a reminder card on the way out, okay? All right, so just give me a minute to make sure that this has all gone through the system and the ladies at the front desk can see it, and then I will be back to let you know that it's okay to go. Just be about probably 3 or 4 minutes, and then we can get you back up front and checked out, okay? All right. Well, it was so nice meeting you. Again, I am Dr. Veda. Really, really glad that you chose me as your first ever doctor, and I will be in touch very soon about your blood test results, okay? Okay, all right. Bye-bye.